afternoon, we have with us Dr. Shatoi King that will be talking with us about women health and child abuse, along with along with my co-host, Ms. Deborah Jackson. I always
Hello.
thank you for being here with me.
Hi.
It's always a pleasure to have you on the show. So again, let's just kind of go ahead and get started. So Dr. King, if you can kind of introduce yourself to everyone, please.
Hi, good evening, everyone. My name is Dr. Shatoi King. I am a nursing professor at University of Texas Medical Branch in Galveston. I've been a nurse for about 16 years, women's health and also pediatrics, med surge, which is regular taking care of adults. And I've been teaching for 10 years. So that is definitely my specialty, education.
Mm.
Thank you. Thank you. Wonderful. Wonderful. And so we can go ahead and get started um, with some questions that we have for Dr. King. Um, Ms. Jackson, do you have anything to start off with, or any particular questions you have? Or
No, I just, in your daily education with students, how often do you use, the headlines of the day in training? Is that, what type of training do those students get to help them identify abuse type situations that they may be encountering in practice?
So, as far as making sure that they're educated on different abuse situations, in courses we go through in the med surg courses and the pediatric courses, we're always teaching the students on what to look for. So if a child comes in, I'll start with children. If a child comes into the facility or to the hospital, and they are, withdrawn, or they have marks on them, and every time that you ask a question, the parent is the one that's answering the question. Those are things that we teach the students to look for. We always want to try to get the child alone if we can, to try to see if we can get them to answer questions. If the parent won't leave the child alone in the room with us, or if the child is very withdrawn or reserved, and they really don't want to talk about different things, those are signs that we look at. And then on the other side with adults, a lot of times women are abused in the highest percentage. The statistic state is when they're pregnant, and that is a lot of times when they find out that their partner is abusive. If the partner again won't leave the room, or if the mom comes in and they have different bruises that, oh, I just fell, or oh, know if they don't have any medical reasons to have those bruises, there we always have to make sure that we're asking the question, do you have any blood disorders, or have you had any of these issues to happen before? Are you taking blood thinners? We want to make sure, and this is on both sides with children or adults, to ask those type of questions. We get a background and a history on the patient. I just give a story of a patient that we had, a child that had been into the emergency room 72 times within a year, and it was only October. And every time that child, and it was something different that was happening with them. And the parent always had an excuse, and we just couldn't figure out exactly what was going on. But finally, we had a doctor that that was kind of new to the system, and came in and literally took over the case, and that child was being abused because the mom or the dad, they just would not leave so that we could ask the proper questions. But as nurses, we have a duty to these patients, especially children. We have a duty to we have a duty to be sure that children are being taken care of properly and effectively.
Thank you for that. And I'm a clinical social worker, and of course, we also have the same obligation that to suspect, to even report even a suspicion. I think a lot of people believe that, we have to be sure, right? But like you said, it's not our job to, we're not the judge, You know, we're not law enforcement, we're not judges. We simply may suspect, and there, you know, are a lot of things that could lead one to believe that this is the case, but there could be other reasons for bruises on kids, right?
Right.
There could be legitimate
Yes,
reasons
they
for
can.
bruises on
They really
children.
could be accident prone. Right.
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 Right. Yeah.
And so that was one of the questions I was talking about before we came on, is I'm, you know, noticing this big push also. You know, I feel bad for doctors, health professionals in general, because you now there's this huge push because there might be over diagnosing or over reporting in terms of abuse. And you know, you're a human being, and you could get it wrong. And so how concerned are your students about that, you know?
Oh, they're very concerned because they see things like right now, because of the pandemic, they're not able to go into the facility as much, which is, you know, we have to do more simulation. We're doing more talking with them and going through situations. So simulation is going through situations, different patient situations. And in the pediatric form, we've had children, you know, in an abusive situation. We've had even the moms, like I was talking about earlier in the OB clinicals. So we're just trying to get them to know the signs and
Mhm.
get them to understand that in nursing, you have to be a good history taker. You have to know how to ask questions effectively. You have to understand what you're looking for, because if
Right.
you can get that child alone, you know, so that you can get the answers that you need. But a lot of times they will open up. Even getting a child life specialist to try to help to explain things. With the older children, you can usually get more of, you know, a sense of if they are being abused or if they're in some
Right.
type of trauma situation.
Right.
Right. In the younger children, it's a little bit harder to get the answers from them. So
Right.
we, you know, we use different techniques to get those questions asked, and we teach the students to understand that they have to make sure that they're good history takers
Mhm.
so
Okay.
that they can get those questions answered.
Great.
Awesome.
Now, since you mentioned that, Dr. King, could you kind of please elaborate a little bit and let our community and our listeners have a better understanding of what is childhood trauma? Because a lot of people really don't understand or have a good idea as to what childhood trauma is. Could you please elaborate a little bit on that?
Sure. So the National Institute of Mental Health states that childhood trauma is the experience of an event that a child is emotionally painful or distressed that,
Mm-hmm.
you know, usually results in mental and physical effects. Like these children can be, you know, early childhood trauma can be something that happened to them usually between the ages of, you know, when birth and all the way to 6 years old. Just think about the two children that we just saw on
Right.
the news.
Exactly.
One where the
Exactly.
child was raped 10 months old, her father, and she died. The other child that was in the
Mm.
car and her dad was arguing with the girlfriend and she died.
Hmm.
And
Yeah.
you never know what was going on
Right.
with that child. Was that child dead before she got in that car?
Mm-hmm.
Had there been anything that had been going on? So as a nurse, when I'm seeing these things on the news, you know, and the parents are fighting in front of the children,
Right.
that is a
Right.
form of
Exactly.
trauma.
Exactly. It's that
And when it
experience. Right.
occurs really early, right, it's that experience. So when
Mm-hmm.
it occurs really early, it can affect their development, and it can their brain development, their ability to attach.
Right.
You know, it can affect a lot of things in their life long term.
Mm-hmm. Yeah.
So that's what childhood trauma is and how it affects those
Right.
children early on.
Right. Because they are experiencing that overwhelming negative experience in their childhood. So therefore, a lot of times, childhood experience can be overwhelming for any child. And this can even happen in relationships, like
Right.
you said, abuse, violence, neglect. And is this what you will call like interpersonal trauma? Is that classified as interpersonal trauma?
It is classified as interpersonal trauma from something done to them, or
Mm-hmm.
emotional or physical neglect, trauma because that parent experienced trauma. And
Mm-hmm.
in the African American community, that is something that we really deal with a lot,
Yes.
because our parents experience trauma,
Mm-hmm.
and because our parents experience trauma, we go through generational curses of trauma. And even though you think about whipping your kids, or
Mm-hmm.
spanking your kids, that can be traumatic for some children,
Yes.
because the children now not built the same way that we were built. We got our butts whooped and we went on about our business,
That's right.
right?
Exactly.
But these children now, they're not the same.
Right.
They're
Exactly.
definitely not
Exactly.
the
That is so
same.
true. So true. And so, with that being said, uh, talking about the trauma effects by early childhood. So, what are some of the signs that you see as far as trauma in a child or in children? What are some of the signs that you may actually see or that you can pick up on?
So so them being withdrawn, or them, every time that you ask a question as the nurse, they're looking to their parent, and the parent is
To
answering the
answer the question.
question.
Mm-hmm.
Or them, the answer question, or them not being able to, smaller kids or even bigger kids, if you bring up a certain person's name around them, or if you bring up a situation, because you never know what type of trauma they can really be going through. They might have been witnessing domestic violence, they
Mm-hmm.
might have experienced physical trauma, they might have some, some type of severe injuries from the trauma,
Right.
and they know that they're hidden. So just think about, I remember a child that I used to see when I was a school nurse, and this child had on long sleeves 24/7.
Yeah.
If it was hot, cold, whatever was going on, they always had on long sleeves.
Hmm.
And finally one day I just asked, why do you always wear long sleeves even when it's 100 degrees
Hmm.
outside?
Right.
And she said, can I trust you? Now, this was a sixth grader. She said,
Hmm.
can I trust you? I said, well, if there's something that you need to tell me, tell me.
Mm-hmm.
And the thing was, she said that she always wore long sleeves because her stepdad always told her how pretty her arms were.
Mm.
So she felt like if she covered herself up, then
Mm-hmm.
maybe he wouldn't touch
You
her.
wouldn't. Yeah.
Mm. Mm.
Okay.
So that was a traumatic experience for that child,
Mm-hmm.
and so just, you have to pick up on things. You have to
Right.
pick up
Right.
on, especially that it's 100 and some degrees outside and this child has on long sleeves and a coat. That
Exactly.
doesn't make sense,
Exactly.
right?
Mm.
Right. And
So as nurses, we have to be mindful, and be able to pick up on things that the normal person wouldn't pick up on.
right. Right. And some of the other things that I have picked up on since being in the field of the things that I do. Also, a lot of times kids tend to have an eating disorder. They have a sleeping disturbance. They become
Oh,
very clingy.
yes.
They
Their
become very
sleep is,
clingy, or either they
yeah.
separation with anxiety, feeling, hopeless, or,
Oh, yeah.
passive. So therefore, that's some of the signs that I have
Mm.
picked up on as far as children, when they have had some type of trauma or abuse going on in their lives. Okay. And I had one.
And then the flip side is aggressiveness.
Yeah.
They become aggressive. Yeah.
Yes,
So
very.
either they're withdrawn or they're aggressive, but a lot of times there's no middle.
Mhm.
Yes, they become very aggressive, very, very much so.
Mhm.
Now, I have a question that someone here in the chat is asking, and they are wanting to know what's your view of as far as children needing both parents, even if one is abusive. What is your
Mhm.
view on that? That's coming from someone in the chat.
So children needing both parents is very important. A nuclear household is what we're supposed to have. You're made
Mm-hmm.
with a mom and a dad. But even if, if it's not a mom and a dad, just having a two-parent household is important for children. But at the same time, even if you are in a two-parent household and the two-parent household is not working, or the parents are fussing and arguing and fighting, and these children are looking at domestic violence in front of them, does it mean because they're in a two-parent household that they're raised with both parents, they're supposed to stay, they're going to be okay?
Right.
That's not necessarily true.
Mm-hmm.
It's many children that have been raised in single parent homes that
Exactly.
have been,
Exactly.
grow up to be amazing adults.
Right.
And it's children that are raised in two parent homes that don't. So my thought is a healthy home is what a child needs.
Right. Exactly.
Yeah.
Exactly. A healthy home. Exactly. Now, with that being said, so can you kind of tell what are the major types of trauma? What are some of the major types of trauma that there is?
So we talked a little bit about it. Some of the major types of trauma would be bullying, community violence,
Mm-hmm.
complex trauma, disasters, physical abuse. We talked about early childhood trauma. That's a major
Mm-hmm.
type.
Mm-hmm.
Medical trauma,
Sexual.
physical abuse, and then sexual abuse,
Yes.
definitely.
Yes.
Mhm.
Mhm.
Yeah.
Yes.
So those are some major types of trauma.
Mm-hmm. And even when you talk that, you even have the war-related trauma and the medical trauma, like you say, the traumatic loss of a parent,
Yes.
something like that, or
Yeah.
either a natural disaster as well could be a trauma. Can be trauma to
Oh
a
yeah.
child.
Mhm.
Yes, definitely, and
This
definitely it's
pandemic
important.
that we're in right now is
Mhm.
definitely trauma
Exactly, exactly.
because
Especially the
it's
part that you
so many
touched on
children.
about the sexual assault. Uh,
Oh,
that is definitely trauma there because it involves unwanted or involuntary sexual behaviors towards, that child or that person. So
exactly.
definitely, definitely.
hmm
Mm-hmm.
and at because we're in this pandemic, these children are at home.
Right.
Mhm.
Sometimes,
Yeah.
as a nurse, and I've been a school nurse before, these children look forward to going to school because they're getting away from the trauma that they have at home.
Exactly.
And now
Exactly.
they're at home with the trauma all the time, and it could get worse. So
Right.
those are things that, and they did say that that statistics have shown that child abuse levels have went up since this
Yes.
pandemic has started.
Mm-hmm.
So that was one of those stats that is concerning, right?
Mm-hmm.
We that they're going down, but we know
Right.
they're going up. We know that it's occurring, right?
Right. It
But
is
we
definitely
can't see
occurring.
it because they're not in
Right.
school. The
Mm-hmm.
schools aren't reporting it. They're probably not going to a lot of doctor visits also. So a lot of people are missing some of these well care visits that they should be going to. And so
Mm-hmm.
Right.
it could be increasing. I know that in
Right.
our counseling agency that in general, there's a lot of distress, and you could even say trauma
Right.
that is being felt by parents who
Mm-hmm.
are feeling that they are not prepared to be able to teach children, even small children,
Mm-hmm.
with the lessons, and they're feeling angry because they feel like this is the school district's job and I paid these taxes, or we pay taxes, and I'm having to do all this and I don't know how to do it, and I don't have the skill set to
Mm-hmm.
teach a child. And so the
Right.
poor child is being traumatized because they're
Mm-hmm.
just trying to learn math,
Exactly.
right? And they're trying to learn their ABCs or whatever. And you've got this parent who that is not their skill set.
Right.
And so this
Exactly.
yelling and arguing and a lot of abuse situations are occurring. And we don't, it's driving me crazy. It's driving a
Mm-hmm.
lot of us crazy because we don't know that we can't see a lot of these
Right.
things.
Exactly.
Other
Exactly.
family
Right.
members, if there are people who are online, we're asking, please check in with
Mm-hmm.
your family members,
Right.
especially if you know
Exactly.
that they have a propensity to argue and yell and to have short tempers. But we are highly concerned that
Right.
this is going on, and
Yeah. Most definitely.
numbers we know that those numbers are high.
Oh yeah, the numbers are there because you have to look at the professionals that are usually the ones that call in the cases, like your teachers, your counselors, babysitters,
Mm.
people of that sort, any type of caregiver. Those children are no longer
Right.
around them. So
Right.
therefore, we don't have anyone that's going to be our eyes and ears right now for us. And
Yeah.
so we
Right.
do know that abuse is happening in the homes. And sometimes you may have a child that may actually pick up the phone and call in themselves. They'll go in another room and call in and say something is actually going on in my home. Because again, they can't go and
Right.
confine in someone that they're accustomed to talking with or someone that they can trust because, right now they're stuck at home with the abuser. And
Yeah.
so, they have to do what they have to do to
That's
make sure that
true.
they're safe. So yeah, we have no one that has been our eyes and ears
And
right now for
we've
us. Yeah, definitely.
right. And we've been home, for a long time right now with these
Very
children. I mean,
long.
I'm home
Definitely.
with 4 of them. So
Yeah.
it's very stressful.
Sure.
I,
Yeah,
I would
definitely.
like to know, how is it going to be after? What are we
Mm-hmm.
going to do? Are we ever going to have a normal again? Will there
Right.
be a new
Mm-hmm.
normal? We don't know.
Yeah.
We don't know what our normal is going to be after this
Mm-hmm.
pandemic is over. So
Exactly.
this is going to be definitely a year of research and a year
Mm-hmm.
of trying to see what is the trauma level. So how did people fare throughout this pandemic?
Yeah.
And adjusting to teaching people how to adjust to change, because change is happening. It is going to continue to happen. And how do you prepare? How do you adjust for that? And how do you get the resources, you
Mm-hmm.
need? How do you get the education that you need? Like here, like we're trying to do now, is to educate, is to give
Mm-hmm.
some
Right.
options for people. And there are a lot of those, there are a lot of ways in which family members can reach out. They can talk to a medical professional. They can talk to a social worker. They can talk to a family friend. They can talk to a teacher. They can talk to the doctor. So we have so many different ways in which people can get help, but they are feeling very isolated because that is what we're
Right.
that's what we're telling people to do, right? Isolate.
Mm-hmm.
And in doing so,
Right.
they're not we're not
What?
seeing the problem.
Mm-hmm. Exactly. Exactly.
Yeah.
So, if we can kind of talk a little bit about what can women do at this particular point, if they are not seeking any type of medical help, like if they do need to go to the doctor for a well woman exam and they're not able to get out. So, is there anything that they can do to help protect their health during this pandemic? Is it something that women can actually do?
Well, the most important thing during this pandemic is washing your hands.
Mm.
Washing
Mm-hmm.
your hands and making sure that you're protecting yourself and wearing your mask and staying away from people that you think are sick. You have
Mm-hmm.
to kind of form a bubble for yourself.
Yeah.
And if there are things that you need to do, having an emergency contact,
Mhm.
knowing who you can call or a number that you can press a
Mm-hmm.
button for, and they're going to be on their way. Those are things that are really important for women, especially if they are in abusive relationships, or if they're
Exactly.
finding out
Mm-hmm.
now that we've been at home all of this time and he really doesn't like me.
Mm-hmm.
Those are things that are
Yeah.
important. People separate. People people find out, they really find out, man, I've been sleeping next to this person for 15 years, I really don't know them.
Mm-hmm.
you
Mhm.
know
Right.
they go to work, you go to work, he goes to work, she goes to work, and then y'all meet in the evening. Well, that's not the way that it's been.
Right. Exactly. Exactly.
You've been at home. At home since March the 6th. Thank God I like my husband and these kids, because this is a lot, not being
Yeah.
able
Yeah.
to go to
Right.
work, right?
Exactly.
So definitely for women, you want to have an outlet. If you got to get
Mm-hmm.
outside and sit in the backyard for a while just to get out of the house,
Right.
or going to the grocery store, or trying to garden, or maybe picking up a new hobby.
Mm-hmm.
um those are things that are important for your mental health.
Mhm.
You gotta take that the mental health is the most important thing.
Mhm.
Yeah.
And then when you are able to go back to the doctor's offices, making sure that you're keeping your immunizations up, that you're keeping, being checked. Just because you're in a monogamous relationship doesn't mean that you shouldn't be checked for, STDs, diseases, anything. You want to make sure that your body is where it's supposed to be, when that you're in your optimal level of health. That's where you want to be. That's for anybody, but especially women, because we are the ones that definitely will catch more things, because we're being that person that's monogamous. But what if our partner is not? So
Right.
you always want to make sure that you're staying up on your health. And then it's breast cancer awareness. Go get your mammograms. If you
Exactly.
have family that have had issues, or I never knew, even with the mammograms, but my aunt and my mom had issues with their uterus. I never knew that until I got pregnant. Nobody told me those things. And
Mhm.
again, I go back to the Black community, because what were we told? Oh, they just had a baby early, or all babies came
Yep.
early. Well,
Mhm.
that's something wrong, right?
Yeah.
And the other thing that I hear a lot is, oh, I bled a lot when I had cycles. That's not normal.
Mhm.
Heavy bleeding, and clots and those things. Your parent just tell you, oh, just go take a Tylenol and lay down. Those things are not normal. So
Mhm.
those are things that you want to make sure that you're going to the doctor and being checked for. It's not normal for you to bleed that heavy. You should
Right.
go and get checked.
Mhm.
Fibroids are not normal. You don't have to live with that. They have procedures to help you with those things.
Yes.
So
Definitely.
women's health is very important, because it's a lot of things that we've been told, that we think is normal, and it's not.
Yeah.
Exactly. And
And then
something else.
I wanted
I'm
to
sorry.
just throw in too, during the emergency measures for COVID, teleservices, telephone, telehealth are widely being used by all insurance companies. A
Mhm.
lot of insurance companies are waiving copays even during the
Right.
pandemic. And so I'm not really sure how many people know that. Sometimes people just, assume I'm just not going to go to the doctor and or I can't afford anything because I may have lost my job, but they've waived payments during this time
Mhm.
of pandemics, and you can even get it on the telephone if you don't have access to a computer, those kind of things, and you can call 211 if you don't have insurance. You can
Right.
still get telephone and video services. You can just call 211 to find resources. There are lots of resources that people can have free money
Mhm.
out there to help with medical bills or medical assistance, or even just co-payments
Right.
for people. So there are an enormous amount of resources during this time period. I can't say that they're going to exist
Yeah.
after COVID, but for sure there
Mhm.
are a considerable number of resources at
Yeah.
this time.
And something else that I found out that I think is true as well, because during this time with COVID-19, it has driven a global spark in reporting, of course, domestic violence in the home, where you're leaving the women and the girls isolated with the abuser, but it's also leading to
Oh yeah.
increased unwanted pregnancies as well.
Oh,
That's
wow,
the issue as well.
wow,
Mm-hmm.
wow. That's
Yeah,
sad.
yeah,
That's disturbing and sad to
yeah,
hear.
definitely, definitely.
Dr. King,
Yeah.
one of the things I know that when you're we're talking about children, but small children grow into big children, right? And so we've talked about trauma, and so these small people who've been traumatized turn into these big people who come in for maybe medical care or just wellness exams, and
Hmm.
you're seeing the residual effects of that early on trauma that really hasn't been taken care of. Maybe they've never had any counseling, or maybe they've had very little, or maybe it just wasn't effective, but they or just didn't deal with it. So do you see that a lot? Is that are you is that a part of your education about kind of the developmental part of this abuse syndrome or trauma syndrome?
So we don't go into a lot of it. We just give the students the different types and tell them what to look for, because a lot of that, is that it's a specialty.
Yeah.
So pediatrics is definitely a specialty. They don't get, they get half a semester in that course. So we have to give them the meat and potatoes.
Yeah. Yeah.
So if
Okay.
they were able, if they, a lot of things they're going to learn in the clinical setting. A lot of other things that they'll learn if they go back to nurse practitioner school. If they decide to become a pediatric nurse, they're going to learn those on the job. A lot of those things. Now we
Yeah.
give them lots of resources for them to look at and for them to read over and to to have available for them. But we give them the meat and potatoes. Taking your history, making sure that you know what's going on with your patients, so that you can get back to a full level of health.
Yeah. 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 But these little people become big people that are
They do. Little people with issues become big people with
big
issues, and
people.
if the little people are not taken care of, with especially if they have issues, mental health issues, any of those things, if they don't get it taken care of when they're smaller, then when they become older, it becomes a problem.
Bigger problems, right?
We often talk about breaking the cycle, and so
problem.
that's one of the things that this
Oh,
is about, is trying to affect a change or break that cycle. And
yeah,
as you said, education, in my mind is
yeah,
huge, right? It's
it is.
everything.
Right,
It
exactly.
is. And another thing is, when you say breaking the cycle, my son has been to many different mental health professionals, and what I was told was, oh, we don't do that.
Mm-hmm.
We take our kids to psychiatrists. We don't take our kids to counselor, to psychologists.
Yes,
But
we
why
do.
not?
Yes, yes,
Yeah.
we do.
So
Yeah.
I had to break the cycle. We're
Mhm.
gonna go to the counselor.
Right.
We're gonna get some help, because, like you said, little people turn into big
Thank you
people
for
that
That's
saying
have
that.
right.
issues.
That's right.
Mhm.
Yeah,
Exactly.
yeah.
Right.
Thank
Little
you for
people
saying
turn
that, because I
into
think
big people.
if they see enough Black professionals or Black individuals advocating for help, advocating for how to get help, for getting counseling, getting mental health help, then
Yeah,
the stigma of
Right.
and the historical perspective of, oh, we
yeah,
don't do that, really
yes,
goes away. And it's getting better, for sure. It is getting
yeah.
better, but it's still a problem.
Right.
It's still a
Right.
problem.
Yeah.
Something that's very important for me is, just like you take care of your body, you go to the doctor if you're
That's
diabetic,
right.
you go to the doctor
Mhm.
if you have hypertension,
Take care
you
of
go
that
to the
mind.
doctor if you're pregnant. You gotta take care of your mind.
Yeah.
Your
You
Yeah.
have
mind
to.
is just as important as your heart, lungs,
Mm-hmm.
and every other organ on your body.
Yep.
This
You
is
gotta
very
take care of your
difficult.
mind.
That's very difficult for people to get.
Yeah,
It really is.
yeah.
They
You
don't, and I love to do that analogy that you just did, because when you say that to people, they receive it better. They understand it a lot better, and it's difficult to argue with that. If you were diabetic, what are you going to do?
Exactly.
You're going to, if you
Exactly.
let that go, what
right.
happens?
Mm-hmm.
If you have a heart problem, if you let that go, what
And
happens?
the other is, yeah, the other thing is that people have to know and understand that if you go to the doctor and they put you on medicine and you start to feel better, you can't
Mhm.
stop taking the medicine.
You can't
Right.
You
stop
have to
taking
keep
it.
taking.
You can't.
I tell the heart patients all the time, they say, oh, well, my blood pressure is good. Well, honey, your blood pressure is good because you're taking the medicine. There's
Right.
something wrong internally. So you have to keep taking medicine. The diabetics, the same thing. Well, I'm just going to eat right. No, there's an issue occurring in your body,
Yep.
specifically in the islets of Langerhans, which is where the beta cells are that makes the insulin in your body. So
Mhm.
there's something going on in there that's not functioning correctly. So there's more blood glucose inside of the blood cells than it's supposed to be. So you have to take the medication to get those blood sugar levels correct. So just eating is not always going to fix the problem. Exercising is not always going to fix the problem. So
Right.
you know, sometimes that's the reason why there is medicine out there. That's the reason why there is, doctors out here. They're not here just because,
Right.
they're here to help.
And I just lost a family member this year due to the same effect, just like what you just stated, because they feel that taking the medication makes them feel better after they've taken it for 30 days. They feel like they can stop. And so
Right.
he chose to stop taking blood pressure medication, and we lost him. He hadn't taken it in, I believe, 2 or 3 months, as it was stated to me. And so therefore we lost him.
Wow.
And that really hurted me because, I mean, if the doctor has already told you that you have a condition, you need this medication, in order to keep functioning. But I understand it might not make you feel the way that you want to feel, but this is to keep you going. This is to keep you going.
Exactly.
Yeah. So don't take it upon yourself to take your own body off of the medication. You need to talk with your doctor. You need to talk with your medical professional in reference to this.
I think,
and that goes for antibiotics. Always take your antibiotics. Take full courses of your antibiotics. If the doctor gives you antibiotics, you start feeling better tomorrow, keep taking antibiotics because it's going to come back. Don't save your antibiotics. There's just things that we have to teach patients. Education is very important to me. And that's one thing that I teach people, patients, and the students all the time, that you got to make sure that you understand that you can't just stop. You have to keep taking.
You can't. Yeah, because things happen when you just stop.
Well, and that's true also, I think, when you're looking at child abuse, right? Let's say someone is getting, let's say CPS tells them that they need to go for a parenting course and they need to get counseling, right? So they may do that and they may do well, right? They may be able to get their children back and they may be able to feel like, I was able to put my child in timeout or whatever is taught during the curriculum, right? They may do well. Just like we were talking about, you don't stop your antibiotics, you don't stop taking your medication, you don't stop doing those skill sets that you taught, you don't stop getting help when you feel like you are so angry and are going to explode that you're going to, hurt your children. You don't stop. And so unfortunately, there are people who have been in the system who have, been affected by child abuse, have gotten their children back, have done really well, and they stopped.
Right.
And it just created a bigger problem.
Yeah, it starts again, all over again, because they chose to stop the therapy or whatever. So the cycle starts all over again. So therefore, they're back in the same boat that they were in the beginning. And then you have to come back into CPS. And this is a lot of times where your children may end up being removed, depending on what the situation is. And if your child is removed, then that's forcing you to actually go and take these classes, because then you don't know which way the wind is going to blow. Because if you have to go before the judge and they end up terminating your rights because you've done something, because you chose to stop when you should have continued going, getting the treatments that you needed.
Right.
Your speaker, the person who on the chat who asked about the family, your heart goes out for that kind of question, right? Because who doesn't want their family? Who doesn't want to have your family intact, right? Whatever that family is it's that unit, is you want that intact. And
of course,
but you've got to fight. If you are, just like Dr. King said, though, you have to have a healthy family. And so if you don't have a healthy family, you can have one with help. And so you've got to work, take your medicine, whether that be counseling, a pill, whatever it is, you've got to
Mhm.
work at it, and you've got to continuously do that in order to keep your family healthy, in order to keep your body healthy. You've
Right.
got to work at it.
Right.
So
And the thing is, you have to
appreciate
be
the
okay
question.
with, you definitely have to be okay with taking the medicine or going to get counseling, because a
Mhm.
lot of people are not. And
Yeah.
that's where the main issue comes in, that they're not okay with it,
Mhm.
and they don't want to do it, you know, and that's where the problems come.
Mhm.
Yeah. And,
Exactly.
and reasons why they're not okay with it, are interesting. Sometimes, you'll hear, well, it's none of their business.
Mhm.
And it's not. That's true, right? But when an investigator comes into your home, now you've invited, because you don't have the skill set to
Mhm.
Yeah.
self-regulate, to calm yourself,
Mhm.
however we want to say that. Now you've invited, through the schools, through other people, through neighbors, you've invited an investigator into your home, right? And
Right.
so it's not my business as a counselor, as a clinician, as you as a doctor, treating them medically, right? It's not our business, but that person has now made it the
Make
business
it
of an
our business. Uh-huh.
investigator, who then has to then do their job,
Yeah.
which is to connect you to resources that are going to protect that child and really your family unit. I mean, they're working to preserve your family unit also here, maybe
Mhm.
more so than that person is, because they just said, like Dr. King said, you know, uh, they don't want to do it. They don't think
Mhm.
it's okay to seek
Exactly.
out this type of help.
Exactly. Now,
Yeah.
Dr. King, I have someone
Yes.
in the chat that's asking if you could kind of elaborate a little bit more on the medical trauma. They're kind of want a good clarification as far as what medical trauma is. If you can kind of touch a little bit on that.
So medical trauma is, I know this sounds crazy, but you have parents that actually, it's called Munchausen syndrome,
Mhm.
where parents, take their children to the doctor over and over and over again, and there's actually nothing wrong with them. So it's kind of a mental thing, more so on the parent side than it is on the child side. We've seen
Mm-hmm.
a lot of different movies surrounded by Munchausen, but it is definitely a serious
Mhm.
and a real situation. So, and another thing, medical trauma could be if they've been in a hospital and had the wrong procedure done, or some children don't take to anesthesia the way that others do, and maybe they have actually felt everything that was going on. Those are just situations that fall under medical trauma.
Hmm. Okay. Okay. Now
Um,
let me ask you this: are women mistreated doing doing childbirth or being pregnant? Do you think that there is still a lot of,
Oh,
I would say, domestic violence going on during that time while women are actually pregnant?
yes, domestic violence actually goes up when a woman is pregnant.
Hmm.
They
Okay.
sometimes they find out that their partners are abusive during pregnancy.
Mm-hmm.
And then the mistreatment of women in labor, not just in childbirth, but actually studies show that African American women are being mistreated before, during, and after childbirth.
That's
A
what I was
lot
just
of
about to
uh,
say. Yes.
a lot
Mm-hmm.
of African American women are being told, "Oh, you don't need pain medicine. You'll be able to handle this birth," or
Mm-hmm.
waiting to the last minute to give them the correct care that they need, and not doing C sections when they're making them labor when they should have had C sections, and
Mm-hmm.
moms die, and doctors not listening to these women when they're telling them about the pains that they're having. They're ignoring them, like literally ignoring them.
yeah.
So
Yeah.
what a lot of the researchers are telling these African American women is you need an African American doctor,
Mm-hmm.
Mhm.
because and there are lots of African American doctors out there.
Yes, there
There's
are.
lots of that are OBGYNs.
Mm-hmm.
Get you so that you can make sure that you're getting the correct care and somebody is listening to you, because that's important. That is very important.
Yeah, and I think that's really an important point. I'm not saying that every person who's Black, and that's not what you even said. Every person who's Black has to go to a
Right,
Black physician or
exactly.
whatever.
Right. It's their choice.
However,
Yes.
it is important in some situations that is exactly what you should have, like Dr.
Right.
King said,
Mm-hmm.
because if you are a geriatric, there are gerontologists, right? If you are there are people who study the aging process and
Mm-hmm.
understand
Definitely.
medications for elderly people better than just a general practitioner would. So you
Exactly.
want to have a gerontologist. If
Right.
their primary care doctors, by and large, don't understand psychotropic medications, psychiatric medications, as well as a psychiatrist who tends to study that, and that's where his CEUs tend to his continuous education units tend to be in. So that's not far-fetched for someone to say that you should go to a doctor, an OBGYN who is an African American, if that is what you need.
Right. Mm-hmm. Exactly. Exactly.
Right. Yep.
I like that.
Because
I like that.
I've seen practice also where, um, you know, you're in residencies, and the residencies have the different, ethnicities,
Mhm.
and I've seen a African American doctor with 4 or 5 different Caucasian doctors talking
Mhm.
to an African American patient, and the patient asking questions, and they're not really telling them everything that they need to know.
Right.
And that African American doctor going back into that room
Mm-hmm.
and talking to that patient and actually listening to them and giving them the guidance and the education that they need. And sometimes that's what our people are looking for.
Mhm.
And it's important for us, as as healthcare professionals, to make sure that we're educating our own, because
Right.
they need to get it in the beginning. It's
Mm-hmm.
called primary care, there's secondary care, there's tertiary care.
Mhm.
Primary care is in the homes, in the community centers, in the clinics,
Mhm.
Mm-hmm.
before things get bad.
Right,
And
right.
that's it's so important. I'm passionate about it because I want people to understand that you have to listen to somebody,
Mhm.
and understand. And when you don't understand, ask questions. We're in
Yes.
the age of technology.
Mhm.
Google is out there.
Mhm.
Yes.
If you see something, bring it to the doctor's office. It's okay.
Mhm.
Yes, we say all the time, well, you can't turn Google into a nurse or to a doctor, but still, if you looking, that's what's the importance. The
Mm.
importance is looking and trying to find out what's actually going on with them.
I don't think that, I think that people probably don't know, in terms of education that doctors and everyone have to have. It's big now with health plans and all around for us to have cultural competency. So everybody is
Oh yeah.
being told that you need to be culturally competent. So you need to know about the Indian cultures. You need to know about African cultures. You need to know about the cultures of the people that you treat, because you could be missing a lot in diagnosing. You could be missing a lot in picking up clues on child abuse if
Right.
you really don't
Exactly.
understand the culture of
Mm-hmm.
the people that you're treating.
Right. Exactly. Exactly. Right. Because what
Right.
I found in some
Right.
studying that I was doing, it stated that
Definitely.
Ghana and Nigeria women are the ones that were at the highest risk of experiencing physical and verbal abuse, like 30 minutes prior to giving
Mhm.
birth and approximately 15 minutes after giving birth. Now, these
Hmm.
are women in Ghana and Nigeria. So I
Wow.
thought that was very interesting. I'm like,
Right.
wow. Yeah, very interesting.
Yep.
Very.
Also, you have to look at also the low socioeconomic status combined with other risk factors that affect personal, physical, and psychological health from a childhood to an adulthood.
Mhm.
So that's something that you
Yes.
have there as well. Definitely, definitely. Okay. So, as far as, let's kind of talk a little about COVID. So, as far as who is really at risk when you talk about COVID-19, who are some of the people that are really at risk for this particular virus?
Mm.
So we're talking about African Americans. So African Americans,
Mm-hmm.
also people with pre-existing conditions, and that's
Mm.
not for older people, anybody with a pre-existing condition, women and children, and then also our older adults. They are
Mhm.
definitely more at risk for COVID-19. And then some other things that are important with COVID. And you had asked the question about how to protect yourself, how to protect the children, how to protect women. How do you protect yourself during this COVID? The number one thing is
Uh-huh.
washing your hands, making sure that
Right.
whatever you're doing, washing your hands, using hand
Uh-huh.
sanitizer, using not touching your hand, not touching your face with your hands, keeping away
Uh-huh.
from people that are suspected to have COVID,
Right.
teaching people to mask, having those masks on. Even the kids need to be taught how to wear their masks, because
Right.
children are susceptible, at risk for COVID. So you want to make
Mm-hmm.
sure that that if they're old enough, let them put a mask on.
Mm-hmm.
Mhm.
Cover them up. Making sure that you have your immunizations, keeping your body strong,
Mm-hmm.
eating the right foods. Elderberry, they're just saying vitamin C, elderberry, zinc. Those things are things that are good to put in your body right now. I've been filling my kids up with extra vitamin C and elderberry for the last 6-7 months,
Mm-hmm.
because I don't want anybody to get sick.
Right.
None
Exactly.
of us have, thankfully.
Mhm.
But getting your flu shot, I know people are scared, and I understand that. But as a medical professional that has been getting a flu shot for the past 20 years almost, what it hasn't done anything. It's not going to hurt you. I will talk about the new upcoming COVID vaccine. We're gonna have to get it. This same thing that occurred with that's happening with COVID is what happened with the flu. This same pandemic, we had the flu pandemic in
Swine flu
1918.
and
So
yeah.
this isn't anything. Yeah, this isn't anything new. Just what is it? 8 years ago, we dealt with the Ebola. So
Mhm.
this is nothing new.
Right.
I
Exactly.
looked at a post that I had up a few years ago when Ebola was out, and they were talking about how long the Ebola virus can last in certain things. And one of the
Mm-hmm.
things, I know this is kind of funny, but one of them was semen, and it can last in semen for 82 days. I'm like, oh my
Wow.
God, like who thinks of these types of
Wow.
things?
Yeah.
So you just have to be very careful with everything. So I would say definitely, most important, washing your hands,
Mm-hmm.
making your home a bubble, only going out when you need to.
Mm-hmm.
Everybody it has cabin fever. We definitely have cabin fever. But if you go out, protect yourself,
Yes.
you know,
Yes. Yes.
be 6 feet away from other people.
Mm-hmm.
Avoid big crowds. I don't
Yeah.
go in big
Yeah.
crowds.
Yeah.
If I'm going somewhere, I just want to be at my little table. I
Mhm.
don't want to be in a crowd of 100,
Right.
200, 300,
Exactly. Neither
400
do I.
people. That's just too much.
Yeah.
You know,
Mm-hmm.
healthcare
And another
professionals,
thing that's important, what yeah.
I think
No, I
there's
was just gonna say, and something that we like to do, shake hands. We like to shake hands, right? That's
No,
what we like
we
to do,
stopped
hug
that.
and shake hands. Well,
yeah,
we're in that age of none of that right now. Fist bumps.
yeah,
That's about it. Like, you have to be mindful,
yeah.
because that's how you're
Yes,
gonna keep
absolutely.
yourself protected.
Right.
Yeah.
Exactly. Exactly.
You know, this hand washing is
Dr. Becky.
relatively new, I think, for the public. You know, healthcare professionals have been
Oh
trained
God.
on hand
Yeah.
washing, universal precautions, that kind of thing for years. But just
Right.
in general, maybe a mother might say, "Oh, wash your hands from coming out into play, from outside to play." But it's really more than that. Now, I'm a hand washing freak. I
Yeah.
just I wash my hands so much. I don't think I have fingerprints. But it's that almost that you have to be these days. But I think it's relatively a new concept for people that you would need to wash your hands that often, and it's not just one time a day,
Right.
not just when you get up and
All
go
day.
from the bathroom.
All day, every
Yeah,
day.
yeah, yeah,
All day long. You
yeah.
washing your hands all day.
So can you
Mhm.
imagine, can you imagine being, well, you can't imagine, but so you have to do that for yourself and you're having to make sure these children do it, and then they're not going to want to do it, right? And so
And the
just
thing
that,
with my household, everybody knows they don't, this isn't anything new to them because I've been having them washing their hands since
Yeah.
they were able to, since they were 1 year old, walking, able to, to washing their hands. So,
Yes.
they're, and my kids are so weird. Like they don't even, my one of my daughters, she don't want to go nowhere. Mommy, I'll stay in the car.
but see, you trained them
Come to
early
the house.
on, right? So you trained them early on, right? And so this is
I trained
new to the average parent,
new
Yeah.
to
Mm-hmm.
people. Yeah. To
and
average
so
people, this is very new.
yeah, and I
Yeah.
think it's causing, it is the cause of a lot of the frustration that
Mm-hmm.
they're experiencing, and, even possible causes of some abuse situations because, what if you have, kids, 2-year-olds like to say the word what? No. I mean, they don't,
Uh-huh.
they
Yeah.
don't
That's
want to
their
do
favorite
things.
word. No.
And so
The
I can
word.
imagine having them wash their hands quite often. This is a bunch of no's going on. And
Yeah.
so that's just going to increase.
Exactly.
Yeah.
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 But like Dr. King stated, she started her kids at
Right.
a very early age. And that's
Mhm.
something that I feel like parents should have already been doing from the beginning because it starts at home.
Exactly.
You don't wait to get to
It
school to
starts
teach your child how to wash their hands. Somewhere
right.
parents have to take responsibility of being a parent. It
Mhm.
starts at home.
That's
So
right.
you should have been
It
teaching your
does.
children all along to wash their hands all the time,
That's right.
all day long. So this is
Yeah.
nothing new. It's
Yeah.
just that now that the
Right.
pandemic is here, people are, oh my God, you have to wash your hands.
It's
Well, you should have
mandatory.
been doing this all along. Because I've seen people many
But
of
I
times go in the
for
restroom come
years
out without washing their hands.
and come right out and
Yeah,
come
and don't
right
wash their
out. I
hands.
think it's the most disgustingest thing.
Yeah.
It was funny. A couple of years ago, I went to a conference, and I work at UTMB now, but that's where I also went to school, and I go to a lot of conferences there. And one of my old teachers was in the bathroom with me, and I was washing my hands, and after I finished, she clapped, and I said, "Why are you clapping?" She said, "Because you have always washed your hands the same way since I first met you." I said, "Because my grandmother was a nurse, so I didn't know any other way to wash my hands. So when they taught me in nursing school how to wash my hands, I was like, oh, that's how I wash my hands anyway." So
Anyway,
I was, a person of had to teach everybody else how to wash their hands
yeah,
in
how to
my
wash their
group.
hands.
Um, you know, yeah, I mean, it's, that's the way I've always washed my hands. So things like that are important. They should be mandatory.
Yeah, yeah. Because I recall, I think the last time, it's been some years, the last time I was at Dr. King's house and we had dinner, lunch, or whatever we had, everybody was washing their hands before they ate. Washing their hands before they
Exactly.
ate.
Thank
You know,
God.
that's what we do.
Yeah.
It's important.
Mhm.
Yeah.
Yeah,
Definitely,
and these kids
definitely.
know they better not touch my pot before they wash their hands.
Yep, exactly, exactly. Yeah, yeah. I'm just so excited and elated to have Dr. King here on my show. I really appreciate you for
That's
coming
great.
on and sharing your knowledge with the surrounding community and everyone that is online that's listening to our show this afternoon. I really appreciate you, and as always, I always like to thank my co-host, Ms. Deborah Jackson, because you ladies could be spending your time doing other things, but you chose to be here with Why Are You Here this afternoon, sharing your expertise in your area. I thank you so much, Dr. King, and I thank you as well, Ms. Deborah Jackson, for your time and your your continued commitment as to what you're doing in the community right now, especially with everything that is going on in our world today. So again, this comes to
Definitely.
the end of our program. Again, I'd just like to thank all of our guests that are online watching. If
Thank
you
you,
have
Dr.
any
King.
questions, I ask that you please feel free to email me, paula2012@sbcglobal.net. We are here every Tuesday at 7:30 live, speaking on why are you here, speaking of child abuse. And if you have not picked up your book, Why Are You Here? I ask that you please do so. You won't be disappointed. And it is also on Amazon as well. Again, thank each and every one of you for being here this afternoon with me. This comes to the end of our show.
Thank you,
And I
Dr.
hope everyone have a great afternoon. Please go out and vote.
Yeah.
Early voting has started. And
Yeah.
also make sure you stay safe, stay 6 feet, and all that good stuff. So until next week, everyone stay safe, and I'll see you soon. Bye-bye.
Thank you. Bye, Dr. King. Thank you very much.
Bye-bye.
Bye.